Good afternoon, everyone, and thank you for joining us today for a virtual roundtable on Trump's broken promises on Social Security and Medicare, and his promises to cut funding for these vital programs if he is reelected. My name is Seth Nelson, and I'm the Communications Director for the Maine Democratic Party. Joining us today for this roundtable is State Representative Drew Katine of Westbrook, Chuck Morrison of Portland, and Mary Rita McDevitt of Thomaston. In a moment, we will hear from Chuck and Mary Rita about their experiences with Social Security and Medicare and how their lives would be impacted if Trump is reelected. But first, to hear more about Trump's threats to cut funding for two vital programs to older Mainers, Social Security and Medicare, let's turn to Representative Drew Katine. Representative Katine is serving his fourth term in the Maine House of Representatives. In addition to serving in the legislature, he has experience in the healthcare industry and was named a legislative hero to Maine seniors by Maine's Council on Aging. Please join me in welcoming Representative Drew Katine.
Thank you very much, Seth, and thanks everybody for showing up today to hear this really important conversation about Social Security and Medicare. We all remember 4 years ago when Donald Trump was first running for office and his campaign was full of a lot of big talk and big promises. And when he launched his campaign for president, one of the promises he made was that he would save Social Security and that he would save Medicare and that he would do it without making any cuts to funding for these important programs that so many Americans rely on. And he even went as far as to call out Republicans who wanted to cut those programs and said that they were wrong. So here we are now 4 years later, and looking back, we can see that his promise to protect Social Security and Medicare were frankly just big lies, like so many of the other promises he made back in 2016. He has broken those promises again and again and again. And let's start with Social Security. It's frankly been under constant attack under the Trump presidency. And he's attacked it on numerous occasions. So in his first term, Donald Trump has proposed 4 federal budgets. And in each one of those 4 budgets that Trump has proposed, they've contained billions of dollars of cuts to Social Security. Not in one budget, not in 2 budgets, not in 3 budgets, but in all 4 of his budgets. His budgets have tried to cut Social Security disability insurance. They've tried to limit eligibility for the program. And they've even proposed to reduce benefits for people on the program who rely on it to meet their basic needs. And if Donald Trump gets his way, these cuts would radically change who has access to Social Security, and it would also change how much those people who rely on those programs receive. He's repeatedly taken aim at the payroll tax, which, as we all know, is the funding source for both Social Security and Medicare. And unbelievably, even since the beginning of the coronavirus crisis, Donald Trump has advocated for permanent cuts to the payroll tax, which would impact the viability of Social Security, a source of income that nearly 1 out of every 4 Mainers rely on to survive. Over the summer, he signed executive orders that would delay the payroll tax. But when you look at those orders, they don't include any provisions that would replace the lost funding for Social Security. And this could significantly damage the Social Security program in the future. And if he gets reelected, he said he wants to make this reduction permanent. And that could, in effect, end Social Security as we know it now. So let's talk a little bit about Medicare. Trump has also repeatedly attacked Medicare, which provides healthcare to tens of millions of Americans, primarily older Americans and people with disabilities. And in each of those budgets that I mentioned a few minutes ago, they also would have cut Medicare, sometimes by upwards of $500 billion. This would lead to reduced benefits. It would lead to longer wait lists for services. And many older Mainers would have more difficulty getting their health insurance covered. He's also spent his presidency, as we know, trying to dismantle the Affordable Care Act. And I think people need to realize that that would be seriously damaging for Medicare recipients. If the Affordable Care Act were overturned, those that rely on Medicare would have to pay considerably more for preventative care, like wellness visits or diabetes checks, which are currently free under the ACA. They'd also have to pay more for prescription drugs. One study found that if the ACA were overturned, the millions of Americans covered by Medicare Part D would have to pay an average of $2,000 more in prescription drugs per year. And that's something that older Americans just can't afford. While the last 4 years have been defined by his attempts to cut Medicare and Social Security, let's understand that a second term would be even worse. Trump has said that if he gets reelected, he will look into more permanent cuts to those programs because he thinks it's actually a pretty easy thing to do. So if Trump gets his way, older Americans everywhere will have devastating consequences, but the effects will hit especially hard here in Maine. As the nation's oldest state, a disproportionate number of Mainers rely on Social Security for part or all of their income. Similarly, we're the state with the highest percentage of residents enrolled on Medicare. So if Trump is reelected for another term and is successful at cutting these vital programs, older Mainers across our state are going to be devastated. It's really just that simple. So I'm going to turn it back over to Seth right now, and I'm really excited to hear the stories from some of the people who are joining us today. Thank you, Seth.
Thank you, Representative Katine, for sharing with us how older Mainers will be impacted if Trump's reelected and he follows through on that promise to make permanent cuts to these vital programs. I'd like to now turn it over to two Mainers who have seen the benefits of Social Security and Medicare in their own lives and whose lives would be made much harder if Trump follows through on his threats to defund these vital programs. First, I would like to welcome Chuck Morrison, a resident of Portland. Chuck, the floor is yours.
And start my video, right?
Yeah.
Hello, and thank you for inviting me to speak. Seth, you just disappeared, so I assume you can see me, but I can't see you. Is that right? Okay. Well, I was invited to come and talk about how cuts in Social Security and Medicare would change my life. And I just wanted to tell you a little bit about the beginning of my life and how I got where I am. I grew up in an upper middle class family. My father was a physician, and I grew up in just outside of Boston. Then I attended school in Bates College. I grew up and was raised with the belief that anybody who was lucky in life had a commitment to return to society in some capacity. And my father instilled us with that. And so I started to set out and find places where I could help in the course of my life. And so my junior year, my junior summer between my junior and senior year at Bates, I joined what was called the Vista Associates, a precursor to the Vista program, and taught young black men and young white men from Georgia out in Indiana to improve their English and mathematics. And then I graduated from Bates, and immediately wanting to pursue and contribute something to society, I joined the Peace Corps in Africa and ran well baby clinics for a couple of years in a country called Malawi, which has the dubious distinction of at one point being identified as the poorest country in the world. And then returned to the United States at the end of that time, worked with a local youth group here in Portland, and eventually worked myself into 30 years as a health teacher with the Portland schools, focusing on sexuality issues, trying to improve the rights of sexual minorities and sexual information to teens, including things like dating, violence, etc. During that time, I had, as a teacher, really good health insurance. Upon my retirement, the people in Portland schools said that I should really continue my school insurance, which I did out of my own paycheck, and got a retired part-time into a job counseling men who had committed sexual offenses. This is all by way of saying that I felt a need in my life and a charge for someone who had opportunity in their life to return to society in some significant way. I worked all my life. I was a college level athlete, playing 4 years of football at Bates. I threw the discus and was healthy all my life. until recently. And so in the last 4 years, like many men in Maine, my PSA, the protein-specific antigen, began to rise, and I realized that I needed to do something about prostate cancer. I was diagnosed with prostate cancer, had surgery, and then because the PSA continued to rise, had something like 40 radiation treatments. Subsequent to that, I was feeling pretty good. And because they'd been active all my life, I've summited Mount Washington 2 or 3 times in the winter with crampons on ice axe. 4 or 5 years ago, I lived in Ecuador for the winter. I got to 15,000 feet, or almost 15,000 feet on a mountain that is dubiously pronounced Karawahatsu, with the 3rd highest mountain in Ecuador. And never thought a thing about my health. I remained active. I made sure I exercised reasonably well, and was completely unaware of the fact that I had these issues in my background. Well, subsequent to the prostate cancer, which is now in remission, and I became part of a clinical study. I was offered the opportunity to become part of a clinical study out of Dana-Farber in Boston, to try a new regimen of medication for men that dealt with prostate cancer, which, unbeknownst to me at the time, turns out to be the most common, or one of the 2 most common cancers that men can get. I finished that course of radiation. The PSA came back, and so then I became in the clinical trial, which was continuing treatment with the radiation and a round of medication. And then after that seemed to be put behind me and things were going a little well, I started to get back in shape because the radiation just knocks you down. And so I was slightly anemic and remained slightly anemic. I noticed that I had some chest pain when I was just walking around Back Cove in Portland. It was just before Thanksgiving, so I called my physician. He was out on vacation, got a nurse, and they said, well, I have this chest pain. It sort of feels like a burning in my bronchi when I walk. And she said, Chuck, we take chest pain really seriously. Get yourself either to the hospital or to one of these quick clinics. Well, I went to a quick clinic. The doctor diagnosed a cardiac blockage, blew me away. He gave me an EKG, started me on baby aspirin and a statin, and told me to get to my PCP when he got back from vacation a few days later. And I found out, at that point in time, I had an entirely blocked cardiac artery. I mention all of this because I had been healthy up until I'm 73 now, must have been like age 68 this all began. I probably retired from the counseling of the men who had done the sex offenses at about 68. And, these costs, had I not had Medicare and personal insurance, it would have been absolutely prohibitive. I would have been bankrupted by the whole process. And so now I am here with a cardiac issue. My cancer apparently is in remission, may even get a cure as a result of being in this trial. But all of the costs would have been hugely prohibitive. And without Medicare, I would have been absolutely bankrupted. I mean, I saved right through my life with these various jobs that didn't pay. I mean, Peace Corps paid you $70 a month, and you don't get rich on that. And Vista didn't pay much of anything, and alternative schools didn't pay much of anything. I didn't really have a real job, and that was by choice because I felt the need to return to society. Didn't have a real job until I was working with Portland schools and had employment insurance, health insurance through the schools. I was lucky because I had a fortunate start in life. My health was excellent right up until the last few years of my life. And what would have happened is the money that I managed to scrimp and save in the course of my life by doing things like building my own house would have been absolutely wiped out if Trump gets a reduction in Medicare payments or changes who can be eligible or whatever. So I want to make the point that I worked all my life, and at the very end, things really started to unravel. And I would have become, without Medicare, one of those people who suffered bankruptcy simply because of health issues. It's the number one reason for personal bankruptcy in this country is medical costs. And Trump himself has said that Big Pharma contributes more to political campaigns than any other PAC or organization. And he's also himself said that medical costs are out of control, and we're paying 3, 4, 5, 10 times more for medication than other countries. But at the same time, with that own personal knowledge, he turns around and talks about wanting to cut Medicare costs. And here he is, he's got lifetime insurance as a result of being in the US presidential or in Congress. He makes general comments that COVID-19, which is, a pandemic killing hundreds of thousands of people nationally and millions of people in the world, he's protected because he can go to Walter Reed and get the best medication and medical treatment in the world and not have to pay a penny for it. So from a position of total security, he can talk down the need for Medicare for other folks that have worked all their lives and do not have the advantage of being involved in the presidential or congressional health insurances, or being fully employed in a business that provides insurance through work. So we need to recognize that if he can reduce Social Security and Medicare, there will be tens of thousands of Americans who will lose their insurance. And me, for instance, would become a person with pre-existing conditions, serious pre-existing conditions, that a private insurance company would probably not be willing to even touch, or my premiums would be catastrophically high as a result. For those people that have worked all their lives and hope that they can retire and enjoy the last few years of their life, his cuts in Medicare would be catastrophic. And people who are relying on Social Security, mine is small because it turns out that my Social Security was cut in half because I already receive a Maine state pension through the Portland schools. And I guess Governor Longley was ultimately responsible for cutting those of us that receive state pensions. So instead of receiving the $800 a month that I qualify for under Social Security, I get only $380, which barely covers land taxes. But I'm fortunate because I have Medicare, which keeps me afloat and protects any nest egg that I've managed to save in the course of my life. So I'm just advocating for a social system that protects individuals like me that have worked all their lives and have been responsible with their own personal health, and then at the end of their life find that they just get tagged or would have gotten tagged with these huge prohibitive costs that would have thrown them into bankruptcy. There have been other people I appreciate who have had Medicare needed it for their entire life from the onset because of a congenital issue or whatever. But I guess I sort of represent that group of people that have scrimped and saved their whole life and then find in the retirement that their nest egg without Medicare would have been absolutely annihilated. And I can remember one physician talking about medical expenses, and he said it's one of the best places and most successful economic jobs in the United States is the expense of medical care, because unlike factories that get shipped over and out of seas and jobs that leave and go to China, medical costs are virtually all expended here in the United States, and the money returns directly to the economy. I mean, I couldn't help but notice that GE was the machine that provided my radiation. General Electric was again the company that provided my issues when I had various scans. And so that money gets returned right into the country, and circulates in our economic system, and the money doesn't leave the country and go overseas. So and there is a possibility for people who were in their working years, the real possibility of them being able to return to work and become economic members. So I hope that was helpful, and thank you very much.
Thank you very much, Chuck, for sharing your story with us. We really appreciate it. I'd like to now turn it over to our next guest, Rita McDevitt, who is a resident of Thomaston, who's going to share her story with us about Medicare and Social Security. Mary Rita, the floor is yours.
Hi, my name is Mary Rita McDevitt, and I live in Thomaston. Seems like President Trump wants to lower our income and increase our expenses. President and the Republicans are trying to do away with the pay tax. The payroll tax is the funding mechanism for Social Security and Medicare. I've paid money into Social Security and Medicare all my life for years and years and years. And now I depend on those funds in my retirement as partial income and to keep me from going bankrupt with my medical bills. Like Chuck, I was healthy up till about age 65, and then it went downhill from there. I had 2 open heart surgeries. I have COPD. I have valves that were replaced. And I would have been bankrupt without help from Medicare. There's no doubt about it. My husband and I, despite good health practices, we walk every day, we follow doctor's orders, we eat the right things, we still require a great deal of medication and health services in our retirement. And it's funded by Medicare. Without Medicare, we would be living in fear every day. Putting Medicare at risk unnecessarily puts our happiness at risk in our final years. Putting Medicare at risk also jeopardizes our ability to help other people, our grandchildren and our children who have been affected by the COVID, by losing their jobs. They still need to have health care. They still get sick. We wouldn't be able to help them at all. We wouldn't be able to donate to charities. We wouldn't be able to donate to religious organizations if we had to spend all our money on health care. And like Chuck says, it probably would bankrupt us, and who knows what would happen after that. Without no rational senior wants to changes to Medicare. The poor leadership in this terrible, frightening disease of COVID is enough to make everybody scared. If we didn't have Medicare, we'd not be able to live independently as seniors. We'd have to ask for help from others. We need Medicare as it is. And of course, everything can use an improvement here and there, but we need to keep it. My husband and I thank God every day for Medicare. When we go to the doctor once or twice a week, we think, oh my gosh, what would we do without it? We wouldn't be able to. We just either wouldn't be able to go to the doctor or we wouldn't be able to live on our own. And so I don't think those choices should have to be made by seniors or anybody else. Think about that when you go to the polls. Thank you.
Thank you so much for sharing your story, Mary Rita. It's clear from the stories that Mary Rita and Chuck just shared with us that Social Security and Medicare are incredibly important to older Mainers and their livelihoods. Trump's threats to cut funding from these programs are shameful, and it would cause untold suffering here in Maine and around the country. I'm going to turn it back over to Representative Gatine, who is going to close our roundtable today and tell us a little bit more about Joe Biden's plan to strengthen Social Security and Medicare. Representative Gatine, the floor is yours.
Well, thank you again, Seth. And again, it's really hard to follow those amazing stories that we just heard from Chuck and Mary Rita. And like I said a few minutes ago, President Trump's failure to lead on this issue has been a disgrace. But the truth is, even before he was president, our country did not treat older Americans with the dignity that they deserve. I mean, look, low-wage workers who toil through back-breaking jobs for decades are forced to live out their golden years in poverty. And widows and widowers continue to see sharp declines in their benefits, even while they're still mourning the losses of their loved ones. We can do better. And that's why Joe Biden sees this moment not as a moment to simply help our country get back to where we were before COVID-19 or before Donald Trump was elected president, but to build it back better than it was before. And that's why it's so important that we elect Joe Biden. Unlike President Trump, Joe Biden has a comprehensive plan for older Americans, which includes a commitment to protecting and strengthening Social Security. Joe Biden not only lays out how he will ensure Social Security's long-term solvency, but also about how he'll improve the program by offering more generous benefits and eliminating penalties for teachers and other public sector workers, like the ones that Chuck talked about a few minutes ago. Joe Biden also has a plan to protect and strengthen Medicare as we know it. Instead of attacking the ACA, he's going to build on and improve the Affordable Care Act by giving Americans more choice, like the option to purchase a public health insurance option like Medicare, helping to reduce healthcare costs and making our healthcare system less complex to navigate. And Joe will take on Big Pharma and repeal the outrageous exception allowing drug companies to avoid negotiating with Medicare over drug prices. This will help stop runaway drug prices and profiteering of the drug companies that has a negative impact on older Mainers. And he'll also follow through on his plan to expand Medicare by lowering the eligibility for Medicare from 65 to 60. So it's clear that in order to protect the future of Social Security and Medicare and the future of older adults in Maine and across America who rely on it, we have to defeat Donald Trump and send Joe Biden to the White House this November. It's coming right up. There's only 27 days until Election Day. Voting's already underway here in Maine. I've got my ballot sitting right here on the table, and I can't wait to turn it in. And you should all visit voteinmaine.com for a handy one-stop shop on all the ways you can cast your ballot this election. But the most important thing is, as we approach the end of elections here in Maine, is to make a plan on how you're going to vote and to stick to that plan. And if you'd like to help Maine Democrats defeat Donald Trump and elect Democrats up and down the ballot this November, go to our website, www.maindems.org/volunteer, and find out how you can get involved. Campaign work is a lot of fun. People are really energized, and it's really exciting. So, that ends our roundtable today. Again, I want to thank Seth, and I want to especially thank Mary Rita and Chuck for telling us their story. I want to thank all of you for joining us today, watching us from home. Please stay safe, and please make sure you get out and vote. Thank you very much.